Okay, so good morning and thank you for attending this embargoed virtual press briefing on occupational safety and health in the context of the COVID-19 pandemic and to mark the World Day for Safety and Health at Work on 28th of April. My name is Rosalind Yard, Chief of News and Media at the ILO. We'll begin with a short overview from Vera Paquete-Perdigal, Director of the ILO's Governance and Tripartism Department. This will be followed by Vic van Vuren, Director of ILO's Enterprises Department. Then we'll open the floor for your questions. We also have with us today Joaquim Núñez Pintado, Chief of the ILO's Occupational Safety and Health Branch, and Manal Azzi, Senior Occupational Safety and Health Specialist. Please make sure that your media outlet is added to your names in the participants' lists. All journalist mics will be muted and controlled by our technician. Raise the hand icon to indicate that you have a question and we will go down the list. Then, and we'll unmute your mic and give you the floor. We'll take one question at a time, but if you have a follow-on question, please include it with your original question. And just a reminder that this is an embargoed press briefing. The embargo will lift at 1 minute past midnight on the 28th of April, which is 2 a.m. Geneva time. And we will be sending you an embargoed press release of materials soon after this press briefing is over. So I'll now give the floor to Vera Paquete-Perdigal, Director of the ILO's Governance and Tripartism Department. Thank you.
Can you hear me? Good morning. Thank you for attending this press brief. Every 28th of April, the ILO, along with its member states, globally commemorates the World Day for Safety and Health at Work. Today, as the world is facing... Sorry? Can you hear me? Hello? Okay. Bear with us with these technicians. Every 28th of April, the ILO, along with its member states, globally commemorates the World Day for Safety and Health at Work. Today, as the world is facing a global health threat with major repercussion on workers and business everywhere, it is of crucial importance to alert to the need of ensuring that all workplaces are safe. Workplaces have moved from emergency reactions to a complete shutdown of business, and most recently in some countries to a gradual return to work. Through this evolution, it is important that at this stage we think of the safety and health needs of all workers, those who remain in the front line, those who will be back to work, and those who will continue working remotely. As some countries are easing the lockdown, the ILO calls for investing in safety and health at workplaces in an active dialogue between employers and workers' representatives. All workplaces need to carefully monitor the risk before taking operations and ensure they meet strict occupational safety and health criteria. This includes assessing the levels of exposure for different workers and assessing the premises and operations. This should be followed by adopting adequate engineering and administrative control measures such as physical distance and hygiene, in addition to adapted personal protective equipment where appropriate. So far as reasonable practicable, employers need to develop emergency preparedness plans to be able to cope with possible outbreaks and to consult, inform, and train workers on applicable safety measures. During the phased return to work in some countries, we also have to remember that the risk of transmission is higher for workers in the frontline response, those providing essential service, or workers in the highly concentrated workplaces. It is important to stress that each sector and each workplace are different, and we can all adopt the safest option if we manage risks in accordance with specificities of business operations and workforce features. But we cannot forget that all of those who will stay working from home to sustain operations remotely, these workers may face high levels of stress. It may be difficult for them to combine with family responsibilities simultaneously. And they may be exposed to other risks that can have negative health outcomes in the long run. Finally, we all have to consider the needs of the most vulnerable workers and business, in particular those in the informal economy, in a development context. Measures to protect those workers should include, among others, education and training on safe and healthy work practice, free provision of PPEs as needed, access to public health service, and livelihood alternatives. You can find further details on the Safe Day report that is being launched this month on the occasion. Controlling this new coronavirus, it is a responsibility of all. Public health systems need to extend coverage to all workers. We need to invest in occupational safety and health. The return on investment is unmatched for the health of population and business in the medium and long term. ILO, as the global leader in the area of occupational safety and health, with its numerous international standards and guidance, today stands ready to support member states to ensure safe and healthy working environments. And with our development cooperation, we are supporting constituents to protect workers, business, and employment. Effective occupational safety and health systems play a large part in the overall public health response to the current crisis. Therefore, the ILO urges all governments, employers, and workers to make the necessary efforts to ensure that no more lives are lost. We cannot stress enough the importance of workplaces in limiting the spread of pandemic and salvaguarding the safety, health, and well-being of workers, their families, and communities at large. Thank you.
Thank you very much, Vera. I'll now open the floor to Vic van Vuren, the Director of the ILO's Enterprises Department.
Thank you very much. I hope you can all hear me. I think I'm going to approach this from a small business component and the informal sector and domestic workers, because this is where the impact has been the biggest. What we need to do is get businesses back to work, back to being functional. And in our ILO Small Matters report, we identified that 7 out of 10 enterprises are self-employed small or micro businesses. So there is a critical mass that we have to deal with. It's key for to get back to work because it's their sustainability and their livelihood, and the financial assistance is not getting to these small businesses on a global perspective. You find that the more affluent and more developed economies are more successful than others, but the pain in particular in the continents of Africa and Asia and Latin America is huge. Teleworking has helped, but this is not sustainable, and it's only helping a few. Underpinning getting back to work is obviously occupational safety and health matters. Governments need to be realistic when dealing with small business because they don't have the same means as companies. The informal sector is included. How do we deal with this? It's education, it's information, and it's investment in occupational safety and health matters. We need to realize that small businesses don't have the means and the safety equipment. Governments are going to have to invest and provide and help these businesses get back on their feet. The affordability by way of loans and grants and financial assistance needs to be consistently applied as long as it's necessary. Sometimes we need to look at the role of the small business. They need to be proactive as well. They cannot just sit and wait for government to come up with the rules and regulations. They need to be approaching government with suggestions. Consultation processes need to be put into place where you can consult also in and even in the informal sector. they have these loose and very informal associations which can help resolve matters. Government's role is to give clear guidance as to what is acceptable and what isn't acceptable. Enterprises need to know the rules. They need to apply the rules. The employees need to understand what the rules are and need to make sure that when they go back to work, they too comply with the rules. There has to be communication to clients. Clients need to be aware of what is required of a small enterprise or any enterprise for that matter. And this communication needs to be consistent and regular. We need to explore alternative means of opportunities. We need to look at how new production systems can get up and running to provide a means where perhaps other avenues have been closed. And to this extent, the occupational safety and healthy rules need to be educated or need to be communicated to these new businesses. The informal sector and domestic workers, mobile apps, radio and TV are going to be more and more appropriate means of communicating to them. They don't have internet access like we're talking on the Zoom program today. And we need to look at these alternative mechanisms to educate, inform, and to get training across. In the ILO, we're looking at digital training. We're looking at using radio, we're using television programs to educate and inform the business owners and the public. We'll continue holding these workshops and providing these online platforms and adjusting the content to adapt for the daily challenges that are out there. I think for now I'm going to conclude there, and we'll be ready to answer any questions. The bottom line is looking at the retention of employees, risk management, and restructuring the workforce as best as possible. Thank you.
Thank you very much, Vic. So we'll just open the floor to journalists now. And if you can just say, if it's not clear on your on the screen, if you can just say which outlet you represent. So please put your virtual hand up now. And just to remind you that we do have Vera Paquete-Pegao, the Director of the ILO's Governance and Tripartisan Department, Vic Van Vuuren, Director of the ILO Enterprises, Joaquim Nunes, Chief of the ILO's Occupational Safety and Health Branch, and Manal Azzi, Senior Occupational Safety and Health Specialist with us. So please ask your questions. Okay, I see a question from Christian Ulrich. Christian, go ahead with your question, please.
Hello, good morning. This is Christiana with the German press agency. It's a bit difficult to formulate a question because I have no material. I don't know what your report looks like. I've just heard general guidelines that, like I've heard from every government that I listen to, that people have to be protected and things have to be done for them. But do you have some concrete steps that would be helpful for workers and employers to look at now and maybe to demand from their governments in this phase of easing up the lockdown? Thank you.
Thank you. Manal, perhaps you can answer that question.
Yes, thank you so much for the question. Obviously, the ILO is working against the clock to provide concrete material to our constituents. As a first answer, I would say at the very workplace level, we have produced an action checklist. Keeping in mind that we are talking to enterprises at all sizes. The large ones already have prepared the systems in place. Basically, the message we want to get across is the following. Occupational safety and health management systems exist already in a number of enterprises. They're even recommended and at the government level, and they're legal and they're obligatory. Many of these OSH management systems already require emergency preparedness and response plans. The idea here is to adapt them to the COVID-19 specificities. This is not new to a number of enterprises with the other epidemics that we've gone through, especially the ones related to SARS and MERS and others. And they have been adapted to these respiratory contagious diseases, infectious diseases. So now they need to be looking at these plans. Of course, here I'm talking about more bigger enterprises that have an infrastructure on occupational safety and health and committees, etc. But this is the first step towards action, is to adapt these preparedness plans and to include risk assessments targeted to COVID-19 and its specificities of transmission and contagion. And we are supporting countries in doing that. There are a number of institutes globally that are also providing, for example, return to work guidance already. The ILO is working on something of the sort. WHO also from a different perspective, keeping in mind that different sectors are very different. So the return to work or increasing staff for the healthcare sector requires its own attention to various details, and obviously return to work in a different kind of sector in organizations like ours or yours are very different risk assessments. But the process is the same. It's an adapted risk assessment taking into consideration the specific needs, not only of the workplace premises and operations, but also of the workers themselves. We have high-level exposure, medium-level and low-level exposure, for instance. So we are also relying a lot on national authorities who understand best their national context and the way to reach out to their various enterprises, etc., and the different members of national organizations, be it employer organizations, worker organizations, that play a huge role in getting the message across in the right language to people. And so risk assessments are very particular to each workplace, and different issues need to be considered in terms of the need to return to work. Generally, the concept is if people are able to effectively deliver their work from their home and can effectively remotely do their work until there is a certain treatment or vaccine to this pandemic, there is a call for people to continue to deliver remotely, because physical distancing is one of the main options. And obviously the hierarchy of controls applies here. We focus on engineering controls, so anything we can do with the distancing, with shields that are produced, etc., in the workplace, and then we move to administrative controls in terms of shifts, rotations, one-way hallways, one person per elevator, and all these little details. And last but not least, depending on the sector, personal protective equipment need to be provided at no cost. Obviously, the healthcare sector is another setting, and the requirements are much stricter, labs, etc. But this is the basic hierarchy of controls that we are also applying for COVID-19. Thank you.
Thank you, Manal. I'll take a question now from Gabriela Sotomayor from the Mexican News Agency.
Hi, hello, thank you very much. Sorry, it's Proceso, it's not Mexican News Agency. Just
sorry, Gabriela.
It's okay. Well, thank you for taking my question. You know, Latin America begins its lockdown right now. So what recommendations do you give them to avoid making the same mistakes? And considering that most workers cannot telework in Latin America, for example, in Mexico. And then in Mexico, there is no government support for the middle classes or small business. What are your comments, if you have any comments on Mexican situation? Thank you.
Thank you, Gabriela. One of our experts will come to you right now with your answer. Maybe Vic.
Yes, I can come in on this. We've experienced this across Europe, where it's far more advanced than perhaps in Latin America and the other continents. And during the initial phase, there are three phases. The first is the crisis phase, then there's the reactivation, and then recovery. And what we obviously are encouraging people in the initial stages is to follow the rules and stay at home as much as it's hard to comply. And governments need to set up programs how they can assist those businesses that will come to a standstill. But what we also did is to start encouraging people looking at alternative means of production. So where the most needed areas are going to be is in health and safety and masks, disinfectant. And we're encouraging businesses to use their means to start assisting governments in providing the means in those essential service areas, delivery, food, logistics. And so we're encouraging small businesses to start looking at alternative ways of functioning which will fit in with the essential services rules that are being applied. At the same time, they can start looking at business continuity planning. There are means. We have one in Turin at the International ILO Training Center, where we've got training material that shows small businesses how can they plan to deal with the crisis, reactivation, and recovery process. So education, training, information sharing, these are some of the key things that they can start looking at in order to get through the initial phase. Thank you.
Thank you, Vic. I think Manal wants to add.
I mean, just to add, especially on this point, I mean, this is the importance of social protection in these times, and income security and protections for people who aren't able to continue their work. And the ILO works very heavily on this right now. And this whole crisis, I think, has brought forward the importance of such basic protections for workers that need to now be at their best when the world is facing such a health threat that joins workplaces to communities to families, that joins occupational health with public health initiatives. And this general coordination at national level is of utmost importance. And we're trying to support our countries at the various levels in that. And social protection is, of course, income security when you cannot telework, when your job is not adapted to these, and urging employers to be understanding to these various concerns and trying to avoid as many job losses as possible globally.
Thank you very much, Manal. I'll take the next question from Emma Farge from Reuters.
Hopefully you can hear me. I was curious what advice or guidelines you have in a scenario where the employer is keen to get things running faster than the employees are comfortable with. So, for example, maybe the employees feel like it's too crowded, or maybe they're a person at risk. If a person is refusing to go back to work, are there any particular things in place to protect that person, or what are you kind of advising during this sort of transition period in difficult situations like that? Thank you.
Thank you for your question, Emma. Perhaps Manal, followed by Vic van Vuuren.
I think Joachim wants to answer this, so I'm happy to follow on from him.
That's fine.
Okay, can you hear me now?
We can hear you, Joachim.
Perfect. So I'd recommend, any worker under these circumstances to ask for information to national authorities. So we do know what the international labor standards say on this. Of course, when assessing the risks, employers should also take into attention all that relates, to work organization, work rhythms, working time arrangements, etc. The concentration of workers, as Manal was saying. All of this is part of a process of risk assessment. So the risk assessment has to look into all the material components of work. Again, according to our international labor standards, in a situation where the worker understands or believes that he is exposed to a situation of imminent and serious danger to his life or health, he can, according to national legislation, I would say, refuse to work. But outside that, before taking this kind of action, and again, because national law is quite different from one country to the other, I'd really recommend the workers to look for information and advice from the national authorities, for instance, from the National Labor Inspectorate, and they will be the ones that will know exactly the criteria which is set by national law to deal with these kind of situations.
Just following up on that, obviously our Convention 155, which many are familiar with, clearly has a right to removal. It's also based on reasonable justification from the worker that he or she finds themselves in imminent danger. And of course, this is open to national interpretation and to national legislation, as Joachim has said. But looking at the global picture, the point is, if a worker finds themselves exposed or more at risk, the burden on the employer and on the enterprise is even bigger. We're talking about a communicable disease, an infectious disease, and the quicker this disease spreads and the more severe the consequences on some workers who are vulnerable or have underlying conditions, it will fire back. And so listening to workers in this time is one of our key recommendations, is involving workers in the risk assessment, involving them in the decision-making of them to return to work. We're talking about workers who have been out of work for months now, or now going into lockdown in different phases and having to return to work. That's a phased return, we're calling it. So it's not, all of a sudden you come back to work and it's business as usual. It's not. The virus is still there. We're also dealing with a number of absences where workers are not there, but others have to do the workload to get the products delivered, the production or others sort of the services done. So there's a lot of issues related to the burden on the workers, but also how this relates to the cost, the mental health cost, the absenteeism cost, and the general safety and health well-being that either would allow for business continuity and sustainability at this stage if you invest in safety and health, or it doesn't. And so listening to workers and their wishes, as long as they are justified, of course, is key to moving forward to any possible return to work.
If I may come in here, it's Vic. I think we've got these processes that will determine how and when people get back to work, what is reasonable, what is unreasonable, refusing to work. But we need to be mindful that we're dealing with really abnormal situation. I'll give an example of, you have a single parent where the schools haven't opened, and she's sitting with the 2 children at home. There's a requirement to get back to work. No daycare centers are open. What happens to the children? We need to approach this from a humanitarian point of view, not only a legalistic and procedural way. We also need to look at empathy in the workplace. In Vietnam, we have a situation where a small factory was opening. They took a video of their factory and showed how they distanced the workers one from each other, how they cleaned out the building. They showed how they physically went through and sent it to their employees, showing them how clean the building was, in what state it was, and how they can come back to work. We need to address the anxiety of people and go the extra mile to show them it's safe, it's okay to get back to work, and in the difficult situations, perhaps have a little bit more empathy in saying they can take a little bit longer to get back to work. It's going to have to be case by case.
Thank you very much, Vic. I'll take the next question, which is from Mark Engelhardt.
All right, now I think you have unmuted me. Good morning, everybody. Thanks. You talked earlier about health risks from working remotely, from home, also long time. Could you elaborate a bit, and also could you weigh these risks against the risks, obviously, of COVID transmission when people don't work remotely, but rather in an office environment? Thanks.
Thank you for your question. Manal is going to answer that.
So obviously these are not teleworking situations that have been organized well in advance, where everybody has found an office in their place with a nice desk and an ergonomic chair. These are emergency situations where people have been forced into working from homes. General considerations are, of course, ergonomic and human factors and setups in terms of safety from slips and falls, and electricity and ventilation and lighting, and the basic ergonomic and musculoskeletal disorders. But a lot of it is also focused on psychosocial risks that arise. As Vic mentioned, we're looking at families, either one parent alone or 2 parents need to continue to work as kids are out of schools, out of daycare. And so this simultaneous taking care of raising children, teaching them, opening up a school at home, and not to mention toddlers, and the continuous need and having to continue to work remotely causes an extra burden that we have not seen before. And this also applies to people who generally had help from grandparents, from neighbors, from paid help. During circumstances, a lot of these workers or support is not available at all because of the nature of the pandemic that we are living. And so this has caused a burden. People who don't want to lose their jobs, they continue to deliver and work, but under unprecedented circumstances, and that is the mental health consideration. And there are many guidance to help people in that support. But looking at all of these different risks, there is still a clear recommendation for physical distancing, because if we do continue to have increased spread of the virus, the circumstances are much more problematic. Of course, there are people who are living in quarantine and isolation, who live alone, and who used to use the workplace as their area of social interaction. And these people are also suffering. And so companies, obviously, sometimes the more developed ones are offering different kinds of mental coaching for workers who live alone, offering all kinds of suggestions how management need to stay in contact with their workers, having continuous meeting coffees virtually, etc., to keep people engaged. But this is going to be for the long run, and whatever we do put in place, it needs to be sustainable, and we're learning as we're going. Everyone needs to be innovative, even ergonomically. The guidance out there is be innovative, try to find solutions of where you can sit, how you can organize your time, have this disconnection, and this continuous connection now people have, are they're continuously accessible online on weekends and the evenings, also poses a problem. But this doesn't change the normal psychosocial factors between the effort of demand and resources. And if people are somehow rewarded for the efforts they are made, the stress and coping with that stress is also lighter. And so there are many considerations in these ergonomic and psychosocial factors that have come at us quickly. It's like the world moved quickly overnight into a phase that we may have already been moving towards, but not in this manner.
Okay, do you have, I see no more hands raised, so if you do have any more questions, okay, we have another question here from Christian Ulrich. Christian, go ahead.
Yes, thank you. Manuel, you are describing all the problems that might be arising and that people are facing, but what are the solutions? I think you or someone else mentioned only one person per elevator. I'm looking for something concrete that people who are either working at home or going back, who are going back into their workplace, something concrete that they watch out for. Maybe you can give us some examples of what that could be. Thank you.
Thank you, Christian.
So the ILO report that we launched now for the World Day for Safety and Health at Work describes every single occupational safety and health risk that may arise when you are continuing to work, if you're a frontline worker, not just in healthcare sector, but in services sector, and others who continue to work, and then others who have found themselves working from home. And the ILO, and then we provide control measures for each of these contagion and transmission risk, ergonomic risk, psychosocial risks, but also chemical risks from overuse of detergents and the effect on the respiratory system of workers, and control measures are listed there for all of these risks, obviously. And we also guide people to national practices and guidance on these. And there are numerous numbers of very clear guidance on how to mitigate the risk of mental health burden from home and from return to work and others, and specific details on how to issue a return to work plan. The problem is we can't identify just one example. If you consult the report, and it will be made available, there's a large annex of examples from all regions of the world, be it at the workplace level, from working from home, from teleworking arrangements. The ILO currently on the website has a COVID-19 web page that provides clear guidance for each of the issues I mentioned. I'm not sure if I'm able to give the concrete measures in this press conference, but we're happy to guide you further after further questions and give some very good examples that we think are good international recommendations, as the ILO and the WHO continue to work on a common vision and understanding for gradual return to work and assessing the risk and controlling the measures. And of course, governments have their own national guidance, and OSH institutes have their own national guidance. But these things need to be validated, peer-reviewed. So this is the reason things take time before we just launch different recommendations that are ideal or not, and some work in some settings, others not. For now, this initial report gives an idea of the risks and the control measures, provides a link to existing international guidance as we continue to work on something more adapted as we move forward.
Thank you, Manal. And just a reminder, we will be sending you the report straight after this press briefing. There were some logistical
Rosalind, Can I add something here? Because I think it's important.
Of course.
I'd like just to stress that, I mean, we can provide examples, of course, but I think, the main message here is that each enterprise, each organization, it's different. And again, a successful return to work will determine that each country assesses the specifics of the sectors that they have and how they operate, and also that each enterprise and organization assesses, the specific risks that they have. Because the measures that Manal was referring in terms of physical distancing, etc., only one person taking the elevator, etc. I mean, this depends very much on, the production process that we have in each enterprise, the facilities, the type of workforce. So again, the main message here is that for all of us to be successful from a safety and health perspective and from a contagion perspective, before going back to work, it is important that each organization specifically assesses the risks they have in relation to everything as production processes, workforce, the premises, all the workplaces where the workers have to perform their duties. So it's very important to stress this. So there is no one fits all model. Each organization has to conduct its own specific risk assessment and risk management, and this includes, of course, also public organizations. So I just wanted to add this. Thank you. Thank you,
Joachim. I have a question now from John Zarakostas. John, go ahead.
Yes, good morning. On Joachim's question, I was wondering if you can give us a bit of a bird's eye view. What would be a typical situation for a manufacturing company in electronics or apparel, where traditionally they are working very close to each other and they have to go back to work? What are the ILO guidance to employers and labor unions and government inspectors in this sector, in these sectors, electronics and apparel, for instance? So in Thailand and Bangladesh, for example.
So we do know that in our workplaces where there is a higher concentration of workers, I mean, the risk of exposure is also higher. And the response is that, again, this is specific to each factory, but there's always, a set of measures that, can be taken. And this will be all in terms of providing the physical distancing between the workers, which can determine, the reorganization of working times to avoid that there's a big concentration of workers at the same time in the same areas of the facilities. It can determine even, a reorganization of the production lines. So it's always, measures in terms of, engineering, administrative controls, organizational controls, and then again, if need be, of course, and in addition to other protective measures, also the use of the personal protective equipment as required. But then again, as I was saying, it is fundamental that the measures to be applied are specific to the workplace, and it's also fundamental, as Manal said before, that workers, namely workplace safety committees, are involved on the consultation on what measures should be implemented. Also said that enterprises may be sure that workers will adhere voluntarily to all of these protective measures that will be put in place.
Following on from Joachim, obviously, as this sector has a high concentration, so little practical measures other than rotation and shifts, arrival times, departure times need to be made for these workers. There could be a suggestion to have only a percentage of the workers available on the premises. There have been different innovations in separators between workstations of the workers. Obviously, these can't be plants or things that the virus can be transmitted, and as Joachim said, personal protective equipment may have to be one of the only and play a huge role to protect workers, and that's a whole discussion by itself. Obviously, different companies are taking different measures. We're talking about temperature taking. We're not going to enter into these detailed activities. They could be beneficial and they could prove to be inefficient for different aspects. So, the thermal scanning on arrival, which could detect a high temperature linked to COVID-19, could detect a high temperature linked to an ear infection, or the onset of the temperature has not yet happens, but the person is positive. But the companies are doing different measures to try to at least test and identify people who are positive, and that way they can at least try to manage and accommodate work to continue. But we have to be very careful of false positive, false negatives in all of these cases, and more testing is happening, so we are able to test people as we go and allow for that. Meanwhile, the only thing to be done is to respect the physical distance between workstations, which could mean less workers coming to the office at this to the workplace at the same time, ventilation, opening windows, and those very basic measures of hygiene. Because I mean, even today, even if you walk on the street of Switzerland, you still see people not respecting respiratory etiquette. It doesn't come naturally. People touch their faces all the time. So these are basic things that we need to be raising awareness on. They're practices that we need to continue to take forward for the next year and more. And so training our workers in these highly condensed places on basic hygiene and respiratory hygiene, and then making available sanitizers and washrooms, and making signs. There are people have signs on the bathroom facilities that one person can go in at a time, and then you turn it, keeping doors open if they are able to be open, not to close them so people don't have to touch handles. So there are little practical things that people are doing so that there's minimal touching of possibly infected surfaces. There's a continuous cleaning of these surfaces. We need to invest in continuous cleaning and protecting the cleaners, of course, and workstations that are apart, rotations, shifts, and this is the only way we can continue to work. And then personal protective equipment. Obviously, masks can be engineering controls because they protect, if people are sick, they're like engineering controls to avoid that the person that's sick, and they could be considered personal protective in different ways. That's a sort of a level of detail. Thanks.
Thank you, Manal. Do we have any other questions from the journalists? Okay, I see no other questions. So I think that we will wrap it up there. As I say, that we will send you straight after the press release, plus links to some of the pages that our experts were referring to, including the report. And if you do have any further questions, our experts are available for interview. You can contact me on yard@ilo.org or newsroom@ilo.org. But thank you for taking part in this, and have a good day. Bye-bye.